At the Alaska Native Tribal Health Consortium, we often confront challenges in delivering healthcare across Alaska that push us to innovate and collaborate with many partners. In 2020, with the COVID-19 pandemic, we had to shift to find solutions to protect Alaska Native health, but we never wavered from our vision that Alaska Native people are the healthiest people in the world. We're proud of what we've been able to accomplish this year by focusing on collaboration with our tribal health partners, providing extra care for our patients and staff, and helping find community-inspired solutions.
ANMC offers 36 different specialty clinics. When the COVID pandemic hit, we had to modify procedures in order to continue to deliver this essential health care. This included delivering increased amounts of telemedicine. ANTHC has done that for a long period of time and expanded that greatly during the COVID pandemic. We have safety protocols in the specialty clinics, in the operating rooms, and with patient travel as well as provider travel out to the regions to ensure that we can continue to deliver routine needed care to the patients across the state. Patient housing had to quickly modify their operations to ensure that rural patients had a safe place to stay when they were coming in for their routine and specialty care. Since the start of the COVID pandemic, Tribal Health and the Alaska Native Tribal Health Consortium have been early adopters of testing strategies in order to mitigate the spread of COVID-19. ANTHC has been a supporter of tribal health organizations across the state in both supplies and implementing their testing strategies to ensure the safety of the rural communities. Testing is available here on campus through a drive-through as well as a walk-up site. Testing is provided for patients both coming into Anchorage as well as when they leave Anchorage to ensure that they can arrive safely at home.
Between March and September of 2020, we have completed over 100,000 tests, and that equates to a quarter of all of Alaska. If we can update people, if we can provide services to where people know their current status, then they will take the initiative to isolate themselves, to quarantine, to make sure that they are not the source of spreading the virus.
In the Healthy Homes program, we focus on helping rural communities make their homes as healthy as possible. Having a healthy home is essential, especially during this pandemic. You're spending more time inside, you want to make sure that your home is healthy, but also from a cleaning and disinfecting aspect, you want to make sure that you're not transmitting the virus at all in your home. A few of us, not only in DHE but in CHS, have been a part of this Wearing is Caring campaign. There are so many people involved in running the hospital. It's not just doctors and nurses, it's facilities, it's housekeeping. There's so many people involved, and that is rough on them to be wearing a mask and a face shield and scrubs and gloves every single minute. And something as small as a mask can make such a huge difference.
We have our own personal perception of our own hygiene, but when you're looking at the safety of community, especially Indigenous communities who are very close-knit and culturally gather, it really does show the importance and highlight that importance of hygiene. The Portable Alternative Sanitation System, which the acronym is PASS, the PASS units have been installed across the state as an alternative solution for water and sanitation inside the home. So what it allows is an option when you don't have piped systems in a community to not use a wash basin or a honey bucket. Our construction and installation of over 20 PASS units in Kivalina this summer was definitely challenging. We were fortunate enough that the community was deemed us essential. These stations allow for better hygiene, which is very important during a pandemic. So it was really important to them to make sure that these units were installed.
Behavioral health concerns are at the forefront of a lot of people's minds in Alaska, around the country, and even around the globe. And COVID has compounded those issues. Historically, we provided the setting for the training of behavioral health aides who work across the state. And more recently, we've been able to hire licensed psychologists to move toward our goal of delivering behavioral health services out of ANTHC offices. So CISM stands for the Critical Incident Stress Management Framework. It is a framework that is utilized to bolster resilience in organizations when they experience some form of potentially traumatizing experience. Our organization has been amazing in its COVID response. I think what we've done maybe a little different than other places is we've also tried very hard to address and be aware and destigmatize the idea that this was going to be really, really hard on the mental health of people as well, and try and prevent some of the bigger problems that can come by unmet stress needs.
Community health aides or practitioners that live in the community, they're there to provide care basically 24/7 all year. We're usually the only healthcare providers in these communities. We not only care for the health of our people, but protect the health of our people. Because of COVID, CHAPS had to learn how to do COVID-19 screening over the telephone and in the clinic to provide safe health care. We have weekly online COVID-19 updates for the community health aides from the tribal health organizations across Alaska. The design of our classes has changed because of COVID. We have been bringing in 2 students at a time rather than 6, which is the usual number. This began in August, and we completed training for 12 students that had began pre-COVID, and beginning in August, we started having them come in to complete their training. We want everyone to be safe, patients and the providers.
In early March 3rd through 6th, the Commission on Dental Accreditation came to ANTHC to evaluate the Alaska Dental Therapy Educational Program. 2 weeks later, COVID hit and all of our classes were switched to online, and our students were affected by that. We were really nervous about Dakota Accreditation, but we were super excited when we found out in August that we are the first accredited dental therapy program in the nation. Dakota Accreditation just legitimizes what we've been doing in Alaska for the last 15 years with our dental therapists serving our communities. We know they're safe, we know the community benefits from the DHATs working in them, and Dakota Accreditation just proves that what we've been doing here has been working for our patients. We all know that oral health is important to our overall health. And now with this pandemic happening, I think we're all valuing our overall health even more. And so reminding people to take care of their smiles, because hopefully we'll be taking these masks off in the near future, and we want to see those smiles again.
Much of 2020 has been spent working under the challenges of the COVID-19 pandemic. It is incredible to see the staff respond quickly to the needed challenges related to COVID-19.
The unique thing that ANTHC did was also address the mental health challenges that came along with COVID.
We recognize that health is not just going to the hospital or taking medication. It's being healthy in your space, in your home.
Our staff is our driving force, and it is their compassion and their response to the pandemic and their dedication to the cause that keeps us going.